Sorry to hold you up, folks. Apologies. Good evening. I'm joined on my left by Dr. Sharif El-Nahal, who is the Commissioner of the New Jersey Department of Health, and to my right, State Epidemiologist Dr. Christina Tan. Sharif, after I finish my brief remarks, will provide an update on our administration's efforts in response to the adenovirus outbreak here at the Wanacue Center for Nursing and Rehabilitation. I'll give some broad strokes. Sharif will follow up, and Dr. Tan will be here to help answer any questions. Let me say, maybe most importantly, we are all completely and utterly gutted by the knowledge that 7 precious young children have lost their lives, and I asked that we all keep everyone impacted by this outbreak in our thoughts and prayers. Obviously, those blessed little kids, their families and friends, the healthcare workers here who I know are devastated. I say that as much as a dad as I do as governor. And young lives lost are just in a completely unique place. My father-in-law was laid to rest today at the age of 90, and as sad as that is, he lived a full life full of legacy and stories and history, but when you lose a kid, it's devastating. Dr. El-Nahal and Dr. Tan and their teams have been on top of this situation, and Dr. El-Nahal has provided me and my team with regular briefings as I was on the road for the past few days. The Department of Health has been closely coordinating the efforts here and had already sent 2 teams since first being notified. The department is continuing to provide real-time surveillance and assistance to limit the further spread of illness to other center residents and staff. And I'd ask you to keep them in your prayers as well. There are still many folks behind me in this building, including young ones. I remain confident that these efforts and those of other health officials will be invaluable to limiting this outbreak and its impacts. Dr. El-Nahal and Dr. Tan will be able to speak more directly to the actions being implemented, and we will provide further information as events warrant. I want to make it clear that adenovirus poses no immediate threat to the public at large. However, for highly vulnerable populations, such as the children here at Wanacue who have compromised or weakened immune systems and are dependent upon ventilators in particular, it can prove much more serious, and as we have already seen, tragically even fatal. One of the best ways for the rest of us to prevent its spread is to do the simple things. Take care to wash our hands with soap and water. Avoid touching our eyes or nose or mouth with unwashed hands, and to avoid close contact with others who may be sick. I'm the least qualified to say this, but adenovirus is not new to New Jersey. In fact, adenovirus strain number 7, which is the one here, which is particularly vicious, is not new. But it's one of these spectrum viruses that can go from something as simple as a pink eye all the way, particularly with vulnerable kids, in particular with respiratory challenges, that can ultimately be fatal. And as with any illness, those who feel sick should take common sense steps to avoid spreading it to others, such as staying home from either school or work, covering your mouth when coughing or sneezing, and washing your hands. Again, I can't say that enough, with soap and water. We're just at the front end of the flu season, and we are being reminded constantly of the steps we can take to protect ourselves and prevent the spread of communicable illnesses. These events should be a loud wake-up call that we can't let these public service announcements become background noise. All of us can play a role in safeguarding the public's health and well-being. Again, please keep those precious little kids in your thoughts and their families in your thoughts and prayers, as well as the ones still in the building behind me. With that, I will turn the podium over to Dr. Sharif El-Nahal.
Thank you, Governor. First and foremost, as the Governor mentioned, and as we all feel deeply, this is a very tragic situation. We are very heartbroken for the families impacted. Our deepest sympathies are with the loved ones of these special children who have dealt with many medical issues throughout their lives. Unfortunately, the Department of Health learned last night that a 7th child with adenovirus passed away yesterday. These 7 tragic deaths are among 18 confirmed cases that we are tracking very closely at the department as of this afternoon. And adenovirus is among medically fragile children, can be severe and cause death. Our greatest concern at this point is for the health and health care of the medically fragile kids who are currently living in this facility or have been transferred out to a different hospital in the area if they've gotten sick. And our attention is squarely focused on making sure that further cases are minimized in terms of the risk, and that we are getting treatment and the right care to all of those affected. These are patients that at baseline need a lot of care, focus, and attention. Many of these children normally breathe through ventilators connected through something called a tracheostomy tube that goes right into your airway because of their underlying conditions. And some have lived here all or most of their lives for reasons similar to that. They range in age from toddlers to young adults. These are the kids who died. The vast majority are under the age of 18. Some have been hospitalized, and some are being cared for at this facility. This is overall the number of cases that we're seeing. The department continues to work very closely with the facility to ensure that all infection control protocol measures are being followed. At our direction, the facility voluntarily agreed to stop admitting new patients until the outbreak is over. They have also been following all of our recommendations for infection control from the day that they notified us. We've had 2 different inspection teams at the facility since we were notified of this outbreak, and we currently have a staff member from the department's Communicable Disease Service who is on site here today, will be here throughout the weekend, and at least every working day after that until the outbreak is declared over. Normally, adenovirus, as the governor mentioned, causes a mild illness that only lasts a few days. Unfortunately, this strain of adenovirus number 7, its effect on medically fragile children with severely compromised immune systems can lead to the outcome we're seeing. It is a strain that particularly affects communal living arrangements, as the governor mentioned. It is not the first outbreak like this in New Jersey, and it's been known to cause more severe illness even in those with normal immune systems, let alone these children. Each year, there are hundreds of viral outbreaks in nursing homes and assisted living facilities. In this case, it is the combination of the strain of the virus, but more importantly, the fact that these kids are medically fragile at baseline and that any disease affects them more than the general population. So while it is possible that a family member visiting a child here or other folks entering, including the clinical staff that work here, could get the virus, it is much less likely that they will have severe illness and much less likely that they will pass away from this illness. During the course of our work with the facility, we did a surprise inspection to ensure that all infection protocols were being followed, especially since we educated as to how they should approach this. And the inspectors did find minor issues with hand washing. The facility has already started work to fix this at our direction. It can be difficult to impossible to know how the virus got to the facility, what its source was, or what its specific mechanism of spread is from person to person. But we are working with the CDC on this ongoing outbreak investigation, and they're providing guidance as well as technical assistance, as well as lab confirmations of the particular strain of virus that we're seeing. We're also working closely with local public health officials here in Wanacue, including the public health nurse Bernadette McDavick, who has been tremendously helpful and responsive. For context, this virus has been here before in New Jersey, but make no mistake, the consequences here have been drastic, and this has been absolutely wrenching for families, community members, our department, myself personally, and the governor. Since the day we were made aware of this outbreak, our communicable disease services team, led by Dr. Tina Tan, here to my right, worked literally every day to minimize the impact of the outbreak, and we will continue to do so until the outbreak ends. For us, 4 weeks are needed without an additional case reported before we declare the outbreak over. And until then, we will work tirelessly to protect the public health of all New Jerseyans to the best of our ability, especially the most vulnerable among us. Thank you.
Thank you, Sharif. With that, we'll take questions, and I'd ask you to limit it to this, as this is a public health crisis, limit it to this topic, please.
Thank you, Governor. My name is Rose McPartland. My son lives here.
God bless him.
Thank you, sir.
How old is he?
He's 34. He's been through pediatrics, and now he's on the second floor.
Yep.
I haven't been notified from them yet, and I'm here today for answers, and I'm so happy that I knew you would be here, because my husband got wondering Monday night. Nobody told us. I got told 2 weeks ago when he had a cold, which is normal.
Yep.
And nobody told me about any of this. And I also work at a public school. I've taken his laundry home.
Yep.
I'm here for answers, and I'm thanking you for helping us.
Okay.
And,
God bless you. I don't have all the answers. I don't think we have all the answers yet. I will give you a hug though before we leave. But we clearly need to understand the communication here, and if nothing else, let me ask Sharif to come in.
Thanks, Governor. I'm sorry to hear. While I can't speak to the facility's practice in notifying patients, I will say that there has not been a single case outside of the respiratory unit, the vent unit, where we have seen all the cases. So hopefully that's at least somewhat reassuring. Dr. Tan's team was here this week. We also had a different inspection team. They looked at the entire facility, not just that unit, and all the cases so far have been confined there. Again, we're working tirelessly to make sure that doesn't change.
One quick question. Before I went to school today, because I work in a public school in New Jersey with children with autism, I was concerned when I asked if I would come up this afternoon if there was a test that they could give him to see, because I'm concerned if once he has it, it may be difficult. And they said that I didn't really kind of have a right, or they didn't want to test him. So that's another thing. Maybe we can talk about it at a later date if there's a test.
Happy to.
Okay. Thank you for that, ma'am. You were in our prayers too. Please. Did you hear that?
Yeah. So we learned that the first symptom onset for a patient was on September 26th. Is that correct, Dr. Tan? We were notified on October 9th. And we were notified actually after hours. The very next morning, we began our surveillance work with the facility. And the surprise inspection on site happened this past weekend, and we've been on site with Dr. Tan's team since then. I can't speak to the practice of the facility letting us know. They have to notify us when there is identification of an outbreak. It's hard to know when an outbreak starts until you compare the baseline to the number of cases that happen. So you're not going to know the first day a child has symptoms. That's often backtracked. But we're working and we're investigating this every day, and we'll hopefully get more clarity on that.
Yeah, may I just say before the next question, we don't have all the answers, but we're going to do everything we can to get them.
Governor Murphy,
please.
Would you characterize this as an all-hands-on-deck situation to stop the spread? And then also, you talked about real-time surveillance. What exactly does that mean?
I'll let Sharif answer the second. The first answer has to be absolutely yes. We wouldn't be here otherwise. So we are obsessed with trying to figure out what happened, how to prevent this from spreading in any way, and also lessons learned. So that, as we've all said, the adenovirus, unfortunately, we live with it, and it can show up. I think Dr. Tan told me earlier today, a couple of cases of fatalities in 2017. Shows up in college campuses and surfaces where there are germs. So what going forward, what lessons can we learn so that next time something that presents itself like this, we can be even better. Your other, sorry.
And the real-time surveillance.
Yeah, what's that? Yeah.
So the way we're defining that, so first of all, in these outbreaks, we have at least daily, if not multiple times a day, contact with the clinical teams and the facility management to give us updates on every case, how they are doing, and if there's a change clinically that they're seeing, if they're getting worse or better. We're also going to have one of Dr. Tan's team members on site providing information in real time from our department. So we're going to be here in person. We're already here in person. And again, they'll be here through this weekend and at least every working day until the outbreak ends.
Please. So the question is an option to shut the place down. They've already taken the decision of not letting anyone new come in, but I'll defer to the experts in terms of what that would entail.
Yeah, so as the governor mentioned, they are not taking new admissions at our direction. In fact, they made that decision basically the day they notified us, and they've held to it. We have the authority in the department to revoke licensure, but here is the caveat. These patients, as the governor mentioned, and as I've been mentioning, are extremely fragile. And you have to be able to have a plan for where they are going, where they're transferred to. And the sad reality is there aren't that many facilities that are able to care for them. So that decision would only be made down the road. If we have to make that decision down the road, we will. The facility thus far has been cooperating with everything we've asked them to do, and we have a person on site making sure that they're all following infection control protocols, and will continue to do so.
May I just ask Dr. Tan to come in just for a second, if you could, a minute more color on adenovirus, how it evidences itself, the spectrum from the more benign end to the more sinister end.
Right, adenovirus, as the governor and commissioner had mentioned, does present with a myriad of different symptoms. Can usually results in mild respiratory illnesses. However, certain strains are associated with more severe illnesses that can result in hospitalizations and deaths. I mean, again, as alluded to before, adenovirus 7 has been associated with various outbreaks in New Jersey in the past, and deaths as well. Adenovirus also, we have to recognize, is challenging in outbreak circumstances because we have to consider issues with the virus being persistent in the environment. So, we always, take a lot of steps to encourage facilities to exercise a lot of different infection control measures, not only ensuring that the individuals in a facility the well people are separated from the ill people, but making sure that appropriate precautions that staff follow with the patients, as well as with environmental cleaning and disinfection does occur.
Thank you, Dr. Tan. I appreciate that. Please.
Either Dr. Tan or Dr. Buckle, how does adenovirus manifest itself in people with immune systems that are intact? Is it different than in medically fragile people, like people that are...
With immune systems that are intact, as opposed to fragile
For
systems.
members of the public that are concerned.
Yep.
There are many different ways that adenovirus can manifest as illness. You can get pink eye, as the governor had said, or cough. You can get bronchitis, pneumonia, the more serious illnesses that are associated with adenovirus. So it's a whole spectrum of illnesses.
Again, I want to reiterate something I said earlier. This is not a crisis for public at large. So let's all do the smart, simple things like washing hands and keeping hands away from eyes and coughing and sneezing and like this as opposed to like this, and the basic stuff. Other members of the press, please. Sorry. Is there anything we could say? By the way, I'm losing my hearing. I feel like I'm in a surround sound amphitheater here. Anything regarding previous violations?
So these are public reports. We have whenever we do an inspection, there's a period of time where we finalize the report, then we can release it, and you can see the list of citations. We call them findings that they need to correct. They're called citations. We were last here before this past weekend in August, and there were a number of, again, low-level self-limited deficiencies that they had to correct. And they submitted a clear plan of correction. We accepted that plan, and when we came back here over the weekend, we checked each and every one of those, and they had been resolved. So that's the most recent report before this. We're going to issue a final report on the most recent inspection soon enough.
Please, hold on one sec. Hold on, sir. Please, hold on one sec. Hold on, sir. Please.
It's the same topic. You say that they're minor, though, but it wasn't just this past year. The past 3 years, there have been those same deficiencies relating to the hand washing and infection control. If there's a pattern of this, what is done? How does that factor into what you do here going forward?
So this is in no way to defend the practices of any particular facility. I will say that it is rare that in any inspection a facility would come out with no citations. If it's a number of citations, all of which are low level, we ask for a plan of correction, we make sure the facility follows through, and that's what this facility did here. We exercise judgment. If the findings are severe enough to take further action, we will. And we continue to work with this facility to make sure that infection control standard is as top as it can be.
Please. So I'll defer to the experts here, Dr. Tan and Dr. Elnahal, but I've heard from the same places. I've just been in touch with the leaders of 2 organizations that are represented here. This is an ongoing discussion in New Jersey. Staffing levels is a constant point of contention, as I think it rightfully should be. Having said that, I'm not qualified to say that that was a contributing factor here. I've heard the same thing, though. It is a real issue that we need to get our arms around. I'll defer to the experts on whether or not that's a contributing factor here.
Thanks, Governor. Staffing was not a citation in the most recent survey or the survey before that in this facility. That's all I can say. There are staffing standards that regulate medical facilities more generally. I'll have to look at the full report once it's complete to be able to give a full answer to that.
The debate more often than not is, and again, I'm not the expert, so please, as if I have to say that, I'll reiterate that. The debate is more often than not, are the standards right, as opposed to whether or not there was a violation of the standard. Maybe one more, please.
What about somebody from the facility? Nobody from the facility is able to come down, or is there somebody who take questions or take multiple parents, concerns, feel like communication? Is there anybody?
So the question is the facility management making themselves available to answer questions? Sounds like Mom does not think so. I don't have any comment on that other than the lack of communication appears to be an issue here.
I called and Rita's voicemail has been full for 3 days. So
Yeah.
I didn't even give your name and number, 'cause I'm gonna go
I don't have to be an expert, but I am a dad, and to say that's just completely unacceptable. I don't know why, but that can't be right. So I want to say thank you for bearing with us in this chilly moment. I want to thank Dr. Tan, who's an extraordinary professional, Dr. Elnahal, likewise. I mentioned this in passing in my remarks, but as this unfolds, you should assume you'll continue to hear from us, as this is a dynamic process. Keep all these families in your prayers and the healthcare workers, and we will be in touch as soon as we have any further meaningful events or issues to discuss. Many thanks.
Dr. Allen, one follow-up just on the timeline to contain this. Do you have a goal in terms of how long you hope to have this outbreak contained?
Yes, so the definition is that the outbreak ends when it has been 4 weeks since the last case is reported to us without any new cases. So that our work on this outbreak and with this facility will not end until then on this issue. Thank you very much.
Thank you.